You get a sudden feeling of heat, almost like a flushing that can come up through your face, through your neck. You may get red blotches or pink blotches on your skin as you start to feel warm. This can also happen on your chest and on your arms as well. And then there's sweating. In some people, it's profuse sweating. And then sometimes shivering afterwards. And how long does this last? Well, it can last anywhere from 30 seconds to 10 minutes. So what are we talking about? Well, we're talking about hot flashes. Does that sound familiar, guys? We are talking about some of the symptoms of menopause, and many of you might have some of them. Hot flashes being probably the most common and well-known symptom of menopause. But many of my patients wonder if some other symptoms they've been experiencing could be symptoms of menopause as well, and that's what we're going to talk about today. Guys, I'm Dr. Jen Caudle. I'm a practicing family physician and on-air health expert and a video creator. We're just going to go to some of our other symptoms, but first, let me remind you, menopause is when we have stopped having a period for at least 12 months or a year. That's right, our menstrual periods have stopped. That's the period in life where our hormone levels, estrogen, progesterone, are decreasing. And again, periods have stopped for a month. Now, generally, that marks the end of reproductive years, the ability to have children, and the average age at which a woman goes through menopause is about 51 years old. Again, everybody's a little bit different, but that's some averages for you. Now, once again, we know that hot flashes are very common to menopause, but do you know some of the other symptoms that can happen during menopause as well? Well, let's start by talking about sex. That's right, and I mean this quite seriously. As a family doctor, I talk to my patients about literally everything. Sex is a very important part of life, and some of my patients feel that when they enter into the menopause stage, they feel differently, okay? One of the symptoms that many of my patients complain about is vaginal dryness, which of course can change the way they feel during sex. But also, some patients either have less interest or maybe even more interest in sex. Sex drive can also change during menopause as well. Some women have more frequent urinary tract infections or vaginal infections or things like that. Many people and many women may actually have urinary incontinence, which is caused by sort of a weakening of the muscles around the bladder. Okay, but that's not all. I mean, we've talked about the hot flashes, we've talked about sex, as they say, some urinary issues that can happen with menopause, but again, that's not it. If you've wondered if your sleep issues are a part of menopause, well, they certainly could be. And I think many people don't entirely realize this. A good night's sleep is very, very important, but when entering into the menopausal stage, sometimes sleep is disrupted and you don't get as good a sleep as you'd like to or as you used to in the past. Sometimes there are night sweats or hot flashes that happen during the night, or there are other reasons why you're not sleeping as well, hormonal reasons, etc. You're just disrupted. But the idea is, of course, we know what happens when we don't sleep very well. Well, we don't feel very well. But can sleep change during the menopausal years? Absolutely. Sort of along those lines of what I talked about as some of the ramifications of not sleeping well, right, is our mood and how we feel. But separately, sometimes during menopause, women feel that their mood is different, whether they feel more anxious, more depressed, more this, more that, more irritable, more this, more that, as I said. That is not necessarily uncommon. So if you've been wondering if your mood changes may be a part of going through what they call the change or menopause, well, it's certainly possible. These symptoms may certainly be due to, changes in your hormone levels. Of course, lifestyle factors, environmental factors obviously always play a role, but that is something that we must keep in mind. And something else that's really important to talk about is with the decrease in estrogen can come a decrease in bone density. That's right, sort of the strength of our bones, leading to things like osteopenia or osteoporosis. Those are really important conditions to be prevented and to be monitored for. Your doctor really should be working with you to make sure that you're staying on top of your screenings and doing everything you need to keep healthy bones. That's very, very important because postmenopausal women are at risk for bone density issues. Also, heart disease may develop after menopause as well due to loss of estrogen and other things. So there's a wide range of stuff that happens when we enter into menopause. And it ranges from behavioral things, literally how we are sleeping, to mental things, how we are feeling, to physical things, literally hot flashes and so many other things. This video is not to make you feel like you are going into menopause and, oh, you must have menopause if you have these symptoms. It's to remind you that menopause can bring on a lot of symptoms, not just the onset of, or rather the end of your period, okay? So keep that in mind and make sure that if you have any of these symptoms, you're concerned about them, whether or not you think they're related to menopause, you should be talking to your doctor. I'll be doing more videos on menopause, menopausal treatments, and things of that nature, so make sure you stay tuned. Guys, I am Dr. Jen Caudle. I'm a practicing family physician. I do videos every single day on different health topics. Please share this video with other people. If you have not subscribed to my channel, I invite you to do so and click the little bell. Guys, I'm Dr. Jen. I'll see you soon.